Hi guys, welcome to the 𝗖𝗵𝗵𝗵. Myself Dr. 𝗲𝗵𝗵𝗺 and I'm your pediatric faculty. The topic of discussion for today is constipation among children. See, this is one of the very important cause which is often missed by the parents, that the child is constipated. And then you will see the child is going to defecate at any place. Why? Because the child was constipated for like 1, 2, 3 days, and then on 4th day the child will have no control, even if the child is trying to control, and they are going to defecate. Okay, so that's why constipation is actually important. And when you will call it as a constipation in children, say if there is delay or difficulty in defecation for more than 2 weeks, okay, which is responsible for causing some distress anyways, but then defecation, DE is die, and die means 2. So more than equal to 2 weeks period of time we see, and if there is delay or difficulty in defecation for more than 2 weeks, it is diagnostic of constipation. Again, it is seen in 2 to 4 years of age, because this is the time when we do the toilet training, or you are doing weaning. Okay, the breast milk is no longer being given, the child is going to go to the school, and the toilet training is also happening. So what happens in this child? This child is, because breast milk is not there, the fluid intake is less. Okay, exactly, the fluid intake is less. Because less fluid is going, the stools are going to become harder also. Okay, the stools are going to become what? Stools are going to become hard, and because the stools are hard and the child is not properly toilet trained, so the child is going to have what? Constipation. Now, one is going to be a functional constipation. See, functional constipation is the most common cause. Okay, so what happens is, please understand that the defecation in small children, as I've told you, the stool becomes hard, and that's why the defecation is becoming painful. So for most of the young children, small children, this painful defecation, so the child is going to voluntarily withhold the feces, and there will be fecal stasis, hard stools becoming more harder, rectal dilatation, and there will be decreased arch, because the child himself has decided to voluntarily hold that. Okay, but sometimes there are some other diseases like 𝗲𝗵𝗵𝗵 disease. So if you have not seen the lecture of 𝗲𝗵𝗵𝗵 disease, please look at it. Okay, 𝗲𝗵𝗵𝗵 disease, hypothyroidism, celiac disease, okay, lead poisoning, cow's milk, cystic fibrosis, anorectal malformation, and anal eclasia. Now what does this mean? 𝗲𝗵𝗵𝗵 disease, I think you all are aware that this is because there is no ganglion, so there will be failure of relaxation. No ganglion, there will be failure of what? Failure of relaxation is going to be there. This is 𝗲𝗵𝗵𝗵 disease. There is hypothyroidism also, that also causes constipation. Then there is a celiac disease. Something celiac disease is going to happen. And see, for celiac disease, cow milk intolerance, cystic fibrosis is going to be there. Then you have got anorectal malformation. Okay, let's take it one by one. Celiac disease, that means there is no absorption which is occurring properly. Okay, celiac disease means brush border epithelium is lost. Okay, the brush border epithelium is not functioning properly, and then there will be what? There will be malabsorption, and since it's not getting absorbed, everything is inside the stool. The stool is going to become, not absorbed also, and not digested as well. So it is not broken down into small particles, and there will be harder and bulky stools or harder stools. Then lead poisoning also, that's going to be there. Okay, lead poisoning also. And cow milk intolerance. If some children are intolerant to cow milk, so they present with the features of constipation. Cystic fibrosis. Now cystic fibrosis means what? There will be increased secretions. Okay, cystic fibrosis is actually increased secretions. So this is going to add what? This is going to add bulk to the feces and and it is going to be which kind of this thing? Painful defecation. Okay, that's why the child is going to hold, and that's going to cause a constipation. Okay, and A for anal eclasia or anorectal malformation, that means they are not performed properly. Okay, so chal in Hindi is called, chal is go, walk. Okay, so you just want the constipation to walk, the stools to walk in constipation. So chal is the mnemonic for that. Okay, So complications is, one is 𝗵𝗵𝗃. What is 𝗵𝗵𝗃? 𝗵𝗵𝗃, okay, there are actually two terminologies. Let me just tell you. One is going to be enuresis and other is going to be 𝗵𝗵𝗃. 𝗵𝗵𝗃 means what? So enuresis is involuntarily the child is going to urinate, okay, and 𝗵𝗵𝗃 means the child is going to defecate, okay, involuntarily, okay, they'll not have a control, okay, involuntarily, okay. So 𝗵𝗵𝗃. Other thing which can happen, that because of the constipation there can be anal fissures, and of course urinary problems also can occur, okay. So clinical features: decreased appetite, decreased stool frequency, abdominal cramps, nausea, vomiting, and there will be abdominal distension. Even in some thin children, the stool mass is also palpable, and fissures will be there. And once you perform the digital rectal examination, you will see stools in the rectum only, okay. So you take a abdominal x-ray only, if short bowel obstruction and perforation is expected, then only you perform the abdominal x-ray, okay. It's just to exclude the causes or to just check the causes. We do it like if again and again constipation is happening, okay. So what is SBO? Short bowel obstruction, okay. So what is important in this? See, for the sake of infants, we give some sorbitol containing fruit juice, apple, prune, everything. In older children, polyethylene glycol, that's this is a substance, polyethylene glycol, which is given to relieve the constipation, right? Then we have to give high dietary fibers, good hydration, psychological support to the patient, and of course this toilet training also, okay. Fecal impaction, if they are getting impacted in the intestinal wall, start giving the stool softeners, okay, laxative, this you are supposed to give, okay. So this is the cause and the treatment of constipation, and just try and become a doctor that can, even without becoming a pediatrician, that can heal the common problems like this. Thank you so much. God bless you.